Senator Warren just delivered a masterclass in exposing fiscal hypocrisy that should alarm every American who believes government should serve people, not billionaires. What you're about to see is Treasury Secretary Bessent squirming under questioning that reveals the true cost of the Republican Big Beautiful Bill, 16 million Americans losing health care to fund tax cuts for the wealthy.
Thank you, Mr. Chairman. So I want to ask about the Republican Big Beautiful Bill, which will knock about 16 million people off their health care coverage and cut programs that keep groceries cheaper for millions of families in order to try to pay for about $4 trillion in tax giveaways that are mostly going to be sucked up by millionaires, billionaires, and wealthy corporations. So, Mr. Bessent, Secretary Bessent, I'd like to start with a very simple question. Will this bill increase or decrease the deficit?
They're varying scoring on that, Senator Warren.
You're the Secretary of the Treasury, so I'm asking you. What is your view? Will this bill increase or decrease the deficit?
It is my view that over the 10-year window, it will decrease.
You know, do you have anybody who agrees with you on this?
Yes, ma'am.
Let me ask my question.
Okay.
Every credible independent expert agrees that Trump and the Republicans' Big Beautiful Bill would add trillions of dollars to the national debt and would not even come close to paying for itself. The nonpartisan Congressional Budget Office, the Penn-Wharton budget model, and the Yale Budget Lab all agree on this, and they're looking at 10-year windows, thank you. So do the Conservative Tax Foundation and Committee for a Responsible Federal Budget, conservative groups. Even Elon Musk and the Wall Street Journal are criticizing the bill for ballooning the national debt. The only people who are saying publicly that it's not going to add to the national debt are you, Donald Trump, the Republicans in Congress. Do you have an independent group that has put forward numbers that disagrees with all of these conservative groups and disagrees with the Wall Street Journal on this?
Well, Senator, interesting to see you aligned with Elon Musk, but if I add...
You're no more shocked than I am.
If we want to take the full congressional budget scoring, they predict, and I don't agree with their methodology, they predict a $2.4 trillion deficit. But
okay, so the answer to the question is yes.
No, but may I finish? They include that, but they've also scored $2.8 trillion in tariff income. So even in Washington, D.C. math,
okay, so,
in Washington, D.C. math, that is a $400 billion surplus.
Okay, so let me make sure I understand. This bill, you admit, will increase the deficit by $2.4 trillion, but you think there will be another bill and another set of agreements that somehow materialize, haven't materialized so far, don't have any statutory authority, but that will make up the difference. So the answer to the original question, will this bill increase or decrease the deficit? I think you just said it will increase. This bill increases the deficit.
No, I want to use all the CBO scoring, and you can't take one without the other. I don't agree with the CBO.
One is the law that we are scoring, the bill that is in front of us. We don't have a tariff bill in front of us to score. Mr. Secretary, let me go on to the second question. You have said that government spending is, quote, out of control. You have also called government spending, quote, unsustainable. In fact, in the name of fiscal responsibility, you're working with the Republicans on this big, beautiful bill to pass the biggest cuts to Medicaid and the Affordable Care Act in American history. So, Mr. Secretary, help me understand here. Why is the national debt so very important that you're trying to kick 16 million people off their health insurance, but increasing the national debt doesn't seem to matter if you're cutting taxes for billionaires and billionaire corporations?
Well, first of all, huge portion of this goes to family-owned businesses that are pass-through entities that are below that level, Senator. And I am sure you share my goals of Main Street prosperity.
You know, I'm glad to do tax cuts for people of modest means. The question I'm asking is, why does the deficit not matter to you? We're talking about knocking 16 million people off their health care, but it matters not. It does matter to you if we're knocking people off their health care, but not.
Well, first of all, that figure is overstated by 5.1 million. That is amount not attributable to provisions in this bill.
So you think it's okay just to knock 10 million people off their health care?
First of all, let's set that straight. Work requirements account for 8 million of CBO's claim number. Again, we're creating an economy that promotes and rewards.
It's clear, Secretary Bessent, that you don't want to answer the question.
No, Senator, I am answering it.
No, you're not.
And what I want is for Medicaid to be used for mothers and children as it was meant, not for 1.4 million illegal aliens, not for able-bodied people.
Medicaid is not used for people who are not documented. Mr. Chairman, I just want to say here, the part that troubles me the most is that the Secretary is deeply worried about the deficit and is willing to knock 16 million, or as he says, merely 11 million people off their health care. Matters so much, but it doesn't matter so much if you're cutting taxes for billionaires. Then it's okay to run up a big deficit. I think that's wrong.
We do have some differences of opinion. However, we also have a time crunch. I'm going to ask the remaining.
What Senator Warren accomplished in this exchange wasn't just political theater, it was a systematic deconstruction of how fiscal responsibility gets weaponized against the vulnerable while protecting the wealthy. She didn't stumble into this confrontation, she engineered it, using a simple question to expose a moral contradiction that defines modern American policymaking. Warren opened with surgical precision, asking Treasury Secretary Bessent whether the Republican bill would increase or decrease the deficit. That wasn't a random question. It was a trap built on mathematical reality. Every credible analysis, from the nonpartisan Congressional Budget Office to conservative groups like the Tax Foundation, shows the bill explodes the deficit. Bessent knew this. Warren knew. He knew this. The audience was about to watch him choose between honesty and loyalty. Bessent's response revealed the administration's strategy: claim future tariff revenue will magically offset current tax cuts. Warren pounced on this immediately, pointing out they're scoring a bill that exists against revenue from a bill that doesn't exist. This is budget gimmickry at its most transparent. You can't balance today's spending with tomorrow's maybe. But Bessent persisted, clinging to what Warren correctly identified as Washington, D.C. math, the kind where $2.4 trillion in deficits somehow becomes a surplus if you add imaginary revenue. The exchange exposed something deeper than fiscal dishonesty. It revealed the moral architecture of contemporary conservative policy. Warren forced Bessent to defend why cutting health care for 16 million Americans is fiscally responsible. But cutting taxes for billionaires isn't fiscally irresponsible. His answer was telling: deflection, technicalities, and ultimately the claim that Medicaid should be reserved for mothers and children, not able-bodied people or undocumented immigrants. Warren's genius was making this about values, not just numbers. She didn't let Bessent hide behind economic complexity. She stripped the debate down to its moral core. Why does deficit reduction require sacrifice from the poor but not the rich? Why is healthcare spending unsustainable but tax cuts for corporations aren't? The Secretary had no coherent answer because there isn't one that doesn't expose the policy's true priorities. This wasn't accidental. Warren understood that Bessent would try to muddy the waters with competing analyses and technical objections. She cut through that noise by focusing on contradictions. If the deficit matters enough to strip healthcare from millions, it should matter enough to question tax cuts for billionaires. If fiscal discipline is the goal, why does it only apply to spending that helps working families? The broader implications are staggering. When officials use deficit concerns to justify cutting social programs while simultaneously expanding tax cuts for the wealthy, they're not practicing fiscal responsibility. They're practicing fiscal redistribution. They're moving resources from programs that keep families healthy and fed to policies that expand wealth concentration at the top. This exchange also reveals how economic expertise gets weaponized. Bessent's credentials as Treasury Secretary should lend weight to his analysis, but Warren exposed how those credentials become tools for political cover rather than honest assessment. When experts contradict independent analyses without providing credible alternatives, they're not offering expertise, they're offering propaganda dressed in authority. The human cost extends beyond the 16 million losing healthcare. When Medicaid faces cuts while billionaire tax breaks expand, emergency rooms become more crowded, families declare bankruptcy over medical bills, and preventable diseases go untreated. These aren't abstract policy outcomes, they're measurable increases in suffering that serve no fiscal purpose except protecting wealth. Warren's questioning method offers a template for accountability. Don't let officials hide behind process. Don't accept deflection as analysis. When someone claims fiscal responsibility, ask them to explain why that responsibility doesn't apply equally to all spending. When they cite deficit concerns, ask why those concerns evaporate when billionaires benefit. Democracy survives when citizens understand how power justifies itself, and when they demand consistency from those who wield it.